Hi everyone, I'm Paige Abbott, and this is your recovery message for the week of November 27th, 2016. This week what I wanted to talk about was incorporating trauma treatment into your recovery. From what we now know about addiction, we understand that trauma is an aggravator, meaning that it can trigger the addiction-related circuitry and genetics involved with addiction, but it's not specifically a cause of addiction. This is why some people who have addiction do have a history of trauma, but there are other people out there who have addiction who do not have a history of trauma. Whichever camp you fall into, obviously you will need to incorporate that into your recovery as you move forward. And for those who do have a history of trauma in their backgrounds, there can be a lot of confusion, even amongst the healthcare profession, about when to incorporate trauma treatment into recovery. Now, it's my very strong belief, based on a few years of working with individuals with addiction as well as trauma-related issues, that trauma does need to be incorporated into recovery, but it needs to be incorporated once the person is in a fairly stable place in their recovery. Meaning, once they have some time with abstinence from all mood-altering substances, and also time to find stability in their recovery routine. So hopefully the person, and if that person is you, you're feeling quite grounded, you're having moments where you're feeling peaceful, content, you have a number of self-care and coping strategies that you can use so that when you do start to incorporate trauma treatment into your recovery, if there is some destabilization that happens, you have a number of different ways to support yourself as that destabilization happens. And that is the biggest risk when you start to incorporate trauma treatment into recovery, is there is that risk of destabilization. So there can be an increase in things like anxiety symptoms, depressive symptoms, nightmares, flashbacks, anger, and a whole bunch of emotion can come to the surface that I'm sure you can imagine, if someone isn't in the greatest place in their health and in themselves, can be very upsetting. And sometimes people will actually be taken back out, meaning they'll become more active in their addiction again if they aren't at a place where they have enough recovery tools and support around them to support them through that time. So the bottom line with this is I do not recommend anybody to take on trauma treatment very early on in their recovery journey, because that can be very risky for overall health and well-being. So it's only once there has been a foundation of recovery established, which does include abstinence, that I would recommend incorporating trauma treatment. Now, the type of trauma treatment that you receive will vary depending on you, your preference, and some maybe specific scenarios that have happened to you in your past. A lot of people choose to go down the path of receiving treatments like EMDR or tapping, or EFT, which also involves tapping, and others may go down the path of doing things like hypnotherapy or even just incorporating talk therapy that is more focused on the traumatic memories and events from their past. There is no right or wrong when it comes to the path to pursue regarding trauma treatment. The major factor I would say to consider is, where are you at in your recovery journey? And if you're at a place where, like I said, you're feeling pretty stable, pretty tranquil, you have a number of recovery supports around you, a number of self-care techniques that you can use, including things like potentially journaling, meditation, relaxation techniques, your sleep is stable, you're eating well, you're hydrating, you're getting exercise, then with those sorts of self-care mechanisms in place, you may feel able and willing to take on more specific treatment related to your trauma. The other thing I wanted to say is some people who've experienced traumatic incidents in their past actually never feel the need to go down the path of receiving specific treatment for their trauma once they've found recovery. There are people who find that once they have pursued recovery, there's enough exploration of feelings and past and self-care in that the impact of the trauma from their past seems to alleviate. So it gets better just naturally by being in recovery. Now, whichever person you find yourself being, I would just encourage you to pursue your trauma treatment in the safest way possible for you. And I can't emphasize that enough because it's very upsetting to me as a healthcare practitioner to see people who are almost re-traumatized by going down that path of exploring their trauma in depth too fast and too soon. So hopefully this is something you can talk about openly with your healthcare providers, as well as other supports around you, just to have some feedback on when it would be appropriate to go down that route. That's my perspective on how to incorporate trauma into recovery. I hope that you found this message useful, and I certainly wish you the best in your ongoing recovery. I'll talk to you next week. Bye-bye.